Sunshine Longgat from BSN 2-3. So today I will going to demonstrate how to insert catheter for female. So female catheterization is done if the patient can void. First, we need to assess the client's condition if she can hold the urine throughout the procedure. Ma'am, can you hold your urine during the procedure? Thank you, ma'am. Next, we need to ask when does she last voided or the last catheterization. Ma'am, when does your last void? Thank you for your response, ma'am. And lastly, we need to percast the bladder to check if it is full. Then, we need to gather all the equipment needed to save time, energy, and effort, and to have a efficient flow of the procedure. So, the equipment needed are, assuming that this is a sterile catheter with a appropriate size, a catheterization kit composed of, assuming that this is a sterile gloves, drapes, assuming that this is a antiseptic solution, cotton balls, forceps, this is a lubricant, assuming that this is a urine receptacle, a tape, and something to cut the tape. Then, perform routine perineal care to avoid gross contamination of the meatus. First, we need to introduce ourselves and verify the client's identity and discuss or explain the procedure to avoid anxiety and for the patient to cooperate. And we need to introduce ourselves to establish trust, and we need to verify the client's identity to avoid mistakes. So, hi ma'am, I'm Sunshine Longgat, your nurse for today. May I know your name, ma'am? So, Ma'am Garcia, I will going to insert a catheter to help you void. I hope you will going to cooperate with me. Is it okay? Thank you, ma'am. Next, we need to perform hand washing to avoid transmission of microorganisms. Provide privacy for the client's mental stability and to avoid embarrassment. Next, we need to position the client to the comfortable position, and let's assist the patient to dorsal recumbent position by flexing her knee with a leg apart to have a easy access to the area and for the patient to feel comfortable. Next, we need to establish a adequate lighting and position yourself to the right side if you are right-handed and to the left side if you are left-handed to have a easy access to the area and to see it properly. Next, we need to open the catheterization kit to have the materials available, assuming that we already opened the catheterization kit and keep it sterile. Next, we need to wear gloves to ensure that our hands are sterile to avoid contamination of the area and the materials, and put drapes around the client and to the area to expose only the genitalia. So, then put the drapes under the patient. Then the genitalia. Next, organize the other material, like saturate the cotton balls to an antiseptic solution. Open the lubricant package and remove the specimen container and put it nearby to have it ready. Next, lubricate the catheter. And place it with the drainage end inside the container to maintain it sterile. Next, let's clean the meatus to avoid contamination. Let's consider our non-dominant hand as a non-sterile. The non-dominant hand is the hand that touches the skin. And let's use it to hold the labia majora. Hold it with firm position. Take a cotton ball with a forceps using the dominant hand. Use one cotton ball each stroke, and let's wipe it from front to back to avoid contamination. Another. Then for the labia minora, then use another one for the other side. Then for the meatus, using the dominant hand, hold the catheter 2 to 3 inches and slowly insert it to the urethra. Advance the catheter until there is a backflow of urine. Then do not force the catheter through the bladder. Ask the client to breathe deeply. Ma'am, can you breathe deeply? Then slowly rotate the catheter until it felt a resistance affected by the external sphincter. For the client not to feel pain, inflate the balloon with a designated volume to check if the catheter is working. Gently pull the catheter if there is a resistance to ensure that the balloon is inflated. So there is a resistance. Then attach the drainage system if it is not pre-attached. It is where the urine goes. Attach it to the non-removable part of the bed to avoid leakage of the urine, and remove gloves. Remove the drape. Secure the tube by taping it to the legs. Leave some slacking for the movement of the legs, for the catheter not to forcefully move. Wipe the perineal area using the remaining antiseptic solution to make the area clean. Discard all the supply to have a clean area and to avoid contamination of the other things. And perform hand washing to maintain the cleanliness of our hand. Document the procedure including the catheter size and the result of the patient. That's all for insertion of catheter for female. Thank you.